Hi everybody, this is the Are You Protected portion of the lecture for this first week, and we want to talk a little bit about vaccinations, a little more about activities and wellness and prevention as we go through this short section. So we want to make sure that all older adults receive the recommended services that the nation recommends, that the World Health Center or World Health Organization recommends, and some of these are listed on these slides. Everybody who's 6 months and older, it's recommended they get an annual flu vaccination. The pneumococcal vaccination is for all persons age 65 and older, especially if they've been unvaccinated or have not received the vaccine within 5 years. If they were younger than 65 when they got the vaccination, they should get it again at age 65. A screening mammogram should be done every 2 years for women age 50 to 74 years, and after age 74, it's not as essential. The annual colorectal cancer screening is a pretty simple test these days. They can do a fecal occult blood testing. You could also do that at home or in a facility. You could have a sigmoidoscopy or colonoscopy for adults beginning at age 50 and then continuing until they're 75. Everyone who's asymptomatic for diabetes should be checked if their blood pressure is greater than 135/80. Men need to be checked for high cholesterol, age 35 and older, and women once they reach 45 and older, especially if they're at increased risk for coronary artery disease. Osteoporosis screening should happen for women who are 65 and older. Ask everyone about tobacco and provide tobacco cessation interventions for those who do use tobacco. We also want to make sure that we help them with psychosocial issues. Make sure we try to help them move past dwelling on problems, capitalize on previous success or how they're able to participate in activities, adopting positive attitudes, getting priorities in order, and then matching activities with their interests, needs, and limitations. Make sure that everyone has the ability to express their feelings and concerns and certainly have some fun at the same time. We'll talk more about psychosocial concerns as we move through the semester and how older adults experience a great deal of loss, which can impact those psychosocial issues. So cognitive interventions, learn new things, take a class, go to the library, talk about current events, and participate in as many activities as possible. Volunteering, joining groups, and sharing experiences is all really helpful and can help people maintain that high quality of life. Other things that are intellectually stimulating: book clubs and art classes, film screenings, philosophy discussions, creative writing. Many different activities can be helpful for older adults to feel engaged and active in their community. So when we think about health and medicine, we really think that health is the absence of disease. But for older adults, health may really be more than that. It may be to achieve the highest possible quality of life every day. That might mean intellectually, physically, spiritually. It depends a little bit on each person. And so when we focus on wellness and nursing, we're really considering that whole sphere: physical, mental, social, and spiritual. But we want to individualize it for each individual person and make sure we enhance that based on the individual. We know that a lot of nursing theories don't attempt to answer exactly why we age, but really try to guide how we can promote wellness. And then we'll talk more about that functional consequences theory that's mentioned at the bottom of this slide, because it's a really great theory that can promote wellness and function, quality of life in that whole mental, social, and spiritual well-being spheres. So when we look at wellness and we want to help people maintain their wellness, we want to think about how changes in behavior can happen anytime, at any age. We want to use strength-based assessments. Instead of saying someone has a limitation or a disability, why don't we say they have these strengths and these interests? And you know why wellness is important, just because it helps us through every aspect of our lives, quality of health, financially, socially, in the environment, workforce, volunteer spheres. And so wellness is something we'll really focus on throughout the whole semester, on what can we do first of all when we're talking about this topic in order to maintain our wellness, and then we'll also talk about how we can help if a illness or a malfunction has occurred in that area. Improving wellness participation. Think about where each person is. Get them in contact with other people in their area. If they can walk to a nearby building that has some type of engagement that they can participate in, let public health nurses and senior centers know. Share that information with the older adults that you interact with, and provide education sessions that can help support wellness as well. So one of the things you might do when you are in community health is to do an environmental assessment. And one of those things is to take a look at, like, how many walking paths we have. How can we get to an area that has a grocery store or a gas station or the library, and how close are those living areas are. I just popped this little map up. It's of Columbia, and you can actually see there's some different areas here that show, first of all, the walking path here is in red, and that's a trail. And there's lots of streets that go through here, but there's not that many grocery stores. So here we've got a grocery store over here. We've got a gas station here. Seems a lot farther apart than they actually are, probably. There's a pharmacy over here someplace, like pretty close in here. But then there's really nothing else around here, and there's all kinds of housing in this general area. Otherwise, you have to go Chapel Hill, Scott Boulevard, clear over here. Let's see, this way for Walmart. Lucky's, you can't even see on this map. So you can tell that we have a lot of things that are quite a ways, quite a distance away, just based on this little tiny part of the map that's included. I think other countries really do a wellness, I don't know, it's not necessarily an initiative, but focus on wellness in different ways. So here's an individual in Italy who's walking her bicycle. She went and got some water, it looks like, maybe some other things, but she goes to the store every day from where she lives. Many people are on bicycles, and there are people out and walking all the time. And that's one of the things that our society is really lacking today, is to get everyone out walking and to have smaller convenience stores. We use that big Walmart supercenter or other super centers where a smaller convenience store would be more helpful, because we can address some of our older adult needs.